Hello, we're Team Absolute Value Alpha from Arcadia, California, and our product is the application mediAR, which aims to use augmented reality to help doctors rapidly analyze and diagnose patients via interactive 3D imaging. The COVID-19 pandemic has called a strain on the public health system and prevented many patients from being able to see their doctors. In the United States, primary care visits dropped at 21.4% in 2020. This has led telemedicine to become a rapidly growing industry, being valued at $56 billion and projected to grow 25% annually over the next decade. We wish to utilize emerging technologies, including augmented reality, to improve and optimize personalized telemedicine in the 21st century.
We have designed an augmented reality application that can help physicians visualize 3D models of patients for a variety of uses, such as pre-surgery or emergency diagnoses. These models will be derived from scans taken on the patient, such as X-rays and CT scans, and then generated through a machine learning augmented reality. Artificial intelligence can then observe the physical characteristics of the patient, along with previous health conditions or diagnoses, in order to identify early indicators of terminal disease. This AR application will be paired with a companion phone app, which can provide a log of potential symptoms and diagnoses to physicians.
We plan to use the current app prototype using our AR software and scale it to be projected onto the glasses HUD. I will now be navigating through an example of the glasses interface that will be used for training and pre-surgery purposes. Using computer vision, the patient's body can be accurately scanned, producing a 3D visualization of the body as shown on the screen. The mediAR's integrated software also uses machine learning to identify physical symptoms and analyzes external data from patient information, including previous diagnoses, surgeries, X-rays, and CT scans in order to come up with a conclusive diagnosis. The user can view the list of physical symptoms matching the produced diagnosis in order to confirm the results. Voice commands can also be used for easy hands-free navigation of the interface, and all screens projected on the HUD can be adjusted with the mediAR's built-in hand tracking software. This also enables the user to conveniently turn on and off all projections on the screen in case of emergency situations. mediAR glasses are also paired with a companion app that securely stores patient information and data logs. With a user-friendly interface, users can easily navigate through the app. The app will first prompt the user to log in through a secure sign-in flow. This allows the user to access patient information such as patient history, CT scans, and X-rays, while also providing a diagnosis report and potential treatments. The data log screen provides a log of physical symptoms identified while using the glasses. This allows doctors to confirm symptoms and ensure that the mediAR software accurately diagnosed the patient. Finally, in the settings screen, users can adjust the glasses display based on their preferences.
For that, this window will launch, and then the ARKit framework on iOS will be used in order to get an accurate depiction of the surroundings. Then after that, this model can be placed onto any surface. In this case, it's a table right here. And then the model can be scaled up to anywhere from like 100% to like 1000%. And then after that, the model can be moved around. And also the model also follows you wherever you go. So if you're tracking it with the camera, it can be used to position the model differently. So right now we're going to scale it back down to 400% and get a closer view of the patient's head. And as you can see right there, we can just like zoom in on it. Then after that, we can get a view of a patient's chest and arms. Those are usually the place where a lot of diseases target. And then after that, here's an aerial view of like the model. And then after that, this will be the end of our demo. And then we can go back from this view into the previous view and then close the application.